Welcome to Washington Hospital Today, the program dedicated to sharing timely information about the community hospital that's been taking care of Washington Township Healthcare District residents since it opened in 1958. Washington Hospital Today is provided for the sole purpose of informing residents about healthcare topics and issues that have been covered during community forums, free health and wellness classes, or as part of educational sessions held during the district's open board meetings. This program is one more way that Washington Hospital helps empower you, the residents of the district, by providing information needed to make informed decisions about your health.
I'm going to talk about stroke, and obviously the community is very attuned to heart attacks. It's probably between the age of 40 and 60, heart attack is what's going to get all of us. But once you go over the age of 65, stroke becomes the #1 killer. So if you've passed the first hurdle, the second hurdle may get you. And since we have an aging population, stroke is really becoming a problem. Right now, there's about 700,000 strokes a year. In 10 years, we're going to have 1.5 million strokes a year with the aging population. So it's becoming a big deal. And because unlike some of the other diseases, when you have a stroke, you can become debilitated and bedridden. It has a lot of effect on not only that person, but their families and the whole community. So it's a big problem. The reason why we're talking about stroke now, there's a lot of technology that has changed, whether it is from the imaging and diagnosing the stroke or the tools that we use to be able to treat it. 10 years ago, we couldn't do the stuff we do now. And so it's relevant because if you have a stroke and you get yourself to the hospital in time, or your loved one, you may be saved. Okay, so you have to treat a stroke like a heart attack, and you have to, do it. And the common things are, if one side of your body suddenly doesn't move, if you have numbness on one side of your body, if you can't talk, if you have vision problems suddenly, not the little floaters that everyone gets, but you suddenly can't see. Those are the kind of things. Sometimes being extremely dizzy can be a sign of stroke. Those are the common things. And unfortunately, what happens is a lot of people who have, unlike heart attacks, when you have a chest pain, you know there's something wrong. Strokes are painless. So people can't move their arm and they say, well, I'm going to sleep on it and go to see my doctor in the morning. And by that time, he can't move the half of his body and it's too late. So take, word of caution, be careful, take it seriously because it's preventable. So this is where we work. These are x-ray machines that we use. And we use a lot of gadgets, very expensive gadgets to be able to see inside patients. And this is the kind of room that we work in. Strokes can happen in all sorts of patients. This is a 22-year-old. This is the blood vessels in the brain, and the machine takes off the bones. So you're seeing an angiogram of the brain. And I won't go into the detail of it, but this is a blood vessel that is very narrowed over here. So it can happen in a 22-year-old. And he was a Silicon Valley high-tech guy here from India, and he had a stroke when he was using the computer. And we ended up having to go there and putting a stent in there, and he fully recovered. These stents are now available. They've become recently FDA approved for the brain, just for the brain. They're special stents. So we couldn't do that before. Just to let you know, this is another kind of thing. There's other things that can cause strokes. This is a picture of a skull. And what you're seeing here, this is just abnormal amount of blood vessels. We call it an arterial venous malformation. This is an abnormality in the blood vessels that can cause a stroke. So strokes don't necessarily just happen from a blood clot. Another kind is an aneurysm. So where imagine a bubble gum, you blow up a bubble gum and it pops Well, these can pop, and if it pops, it's bad. So, and we go in there and we can fix these, and we can go. Before, we used to have to open the skull, move the brain, and put a clip there on the base of this aneurysm. Now we can go do an angiogram like on that machine that I showed you, float a little catheter inside the brain, and pack it. And in the morning, the patient wakes up thinking, where did I go through them? But we've gone through the groin. So that can cause stroke too. But by and large, most strokes are from little blood clots that go to your brain. And these are some of the other coils that we've used for aneurysms. Anyways, let's go to stroke again. It's the third leading cause of stroke, but it's the #1 cause of death over 65, and we're all reaching that age. Or #1 cause of disability. All my patients and their families tell me they rather die than be bedridden. Every one of them. So it's pretty bad, and we try to prevent it, and so on. Most strokes in this country are what we call a bland stroke and not a hemorrhagic stroke. Most of them are from a blood clot or a blockage that cause the stroke, the vessel to close. About 10 to 12% of the time, it's from a bleed in the brain. Okay? Now, it's interesting, you were talking about LDLs, and it is true, if your LDL goes really low, they have associated that in the Japanese folks. You know, if you go to Japan, half of the strokes there are bleeds. They're different, and this has to do with the genetics. And they have seen in those folks that the LDL is very low. But that doesn't mean that you shouldn't decrease your LDL. I think what it is there's a genetic factor in that group of patients. You should bring your LDL as low as you can because it helps. What is the lowest number of blood pressure that's to prevent stroke? What's the best blood pressure? So this is a little different than the heart. For the brain, the lower the blood pressure, the better. There is no bottom number. So if you have a blood pressure of, let's say, 140, the top number, versus 110, the 110 is more protective for you. If you have it 90, it's more protective. But the problem is, eventually, if your blood pressure gets too low, you're going to pass out. So, and different people are different. Some people have a good muscle in their heart. They can beat it well. Some people don't. So as long as you can tolerate it without getting dizzy, most people, we try to keep their blood pressure on the low side. Now, if you have a lot of blockages in your neck and in your head that you can't, even though your ticker is working well, and you can't get blood there, then we may want to keep your blood pressure higher, so because we want to get that blood up there somehow. So we have to, these are just general guidelines, but we have to kind of take each case by case. So $63 billion were spent in 2007, and it's very expensive. And this is what happens. We have a lot of nursing homes around here, and we have patients just sitting there, and they're silent. They can't say anything, and it's a terrible way. And just time is the thing that you need to know with the brain. If people have calculated how many millions of cells you lose when you have a stroke per minute. So it's amazing. We all know that this is not an emergency, right? And it's cute. But is this an emergency? Now, this is just a cartoon, so this is not an actual. So if you were to see someone with their head cut off, you would say that's terrible. Well, in reality, when someone is having a stroke, that's what's happening. The blood clot goes and lodges somewhere, and there is no more further blood going up above to the brain. So in essence, you're cutting someone's neck off. Okay? And so it is a true emergency. And so if you think of this picture, when you see someone having a stroke, I'm sure one of you will see a stroke in your life. If you see it, take that person to the emergency room. And the key is to get that person fast to the emergency room. The faster you can get them, the more brain you can save. And in the Senate, they are now using a lot of resources. They're passing a lot of laws, and they're starting to reimburse for stroke kind of diseases because they want this technology to be developed because of our aging population. So this is a little older slide, but some of the stuff that can be done is we have TPA, which is a clot-busting agent, which I call it liquid Drano. We put it in the blood vessel and it dissolves the blood clot. And if you show up within now it's 4 hours, we can put this stuff in your vein and it'll go to your brain and it'll dissolve the blood clot. And if you can't move your arm, suddenly you can move it. Pretty miraculous stuff. If it's past that window, the other thing that we can do is pass a catheter all the way to the brain and give the liquid Drano material right there. And we can take it up to 6 hours, and now we have gizmos and roto-rooters that we can use, and I'll show you a few, that you can have an 8-hour window. So this is remarkable. So here's a couple of cases just to show you. This is a 31-year-old who was playing football, and as he's throwing the ball, suddenly becomes paralyzed. This is an angiogram. This is the blood vessels in your brain, and I've taken the bone off of here, but there's supposed to be more blood vessels here that we can't see. And this is a concentric device. It's a little corkscrew device that basically goes and grabs the blood clot. So we're using this to grab the blood clot, and this is the device that you're seeing. And this picture shows that we can actually grab the blood clot and pull it out. And in my office, I have jars of this stuff sitting there from patients that we've taken out, and they've done well. And this is what this little blood clot is what does it. A lot of the time, it comes from the heart. That's what we were talking about atrial fibrillation before. So if you have an arrhythmia of the heart, you're more prone to have this stuff if your heart beats funny. So the heart and brain are related. And so you have to have a good heart to have a good brain, and you have to have a good brain to have a good heart. So this is the before-after picture, and the after. You see there's more blood vessels that you see. And this guy ended up in a coma, and then he walked out of there. So it was amazing, all from that little blood clot. And these blood vessels that I'm showing you are the size of your hair. They're small. And everyone's happy. Okay, so we did a good thing. Here's another case, 87-year-old, who's a lady who comes in with no speech, paralyzed on the right side, and they did a CAT scan and it was normal. Well, obviously she's not normal. There's something wrong. So we took her to the cath lab and we did an angiogram. And this is a side view. Again, you're not seeing the skull and everything, but this blood vessel suddenly comes to a stop. And that blood vessel is your carotid artery here. So it's come to a blockage. And the picture on the right is after we have opened it. Suddenly there's flow. Remember the picture I showed you of the chopped off head? That's basically what you should think of, because there's no flow going to the brain. And unfortunately, because she had that clot there, more clot had gone also to the brain, so we had to use that corkscrew device again to go fish out more stuff out of the brain. Here's this eye socket, just as a point of reference. And this is the amount of stuff we took out. Okay, all that clot. It's amazing. And we opened up her brain. She ended up having a little stroke here. She ended up with mild weakness, but she ended up being able to go home and not end up in a nursing home. Okay. So people say, well, why do you treat an 87-year-old? You should let him pass away. Seriously. And we had a lady who was very sick, near coma, at the age 100. We saved her. At age 101, she wrote her first poetry book. Age 102, she wrote her second poetry book. Then I lost touch with her, but you have to judge everyone differently. So this guy comes in with a narrowing in his blood vessel right there, and he had paralysis on the right side. There's these devices that we have. They're suction devices. And it has a little nose cone like this. imagine you're drinking a milkshake out of a straw. Sometimes it gets clumped there, and sometimes when we have a blood clot and we're trying to suck it out, it gets clumped. Well, if you have a little wire that you can ream inside that milkshake, you can then suddenly get it to open up again. Yeah, we should go to 31 flavors and tell them Baskin-Robbins to put that in all their straws. So suddenly we can have the suction device suddenly up there, and we can take little stuff out. We have more gadgets that we can do this with. All sorts of them are coming out. So we have, and we have ultrasound machines that we can use that kind of macerate the clot at high frequencies. So we got room full of this stuff. But suddenly, sometimes afterwards, when we do the CAT scan, we don't have a great result. This is, I don't know, it doesn't show, it's bright here, but this area of the brain is having a stroke, and the patient, we don't have a good result. So not all the time, can we save people. What I tell people is what makes us sleep at night is we can help more people than we hurt. But you are definitely playing with fire. It's a bad disease, and the outcomes are not always perfect. So it's a difficult thing. These are other pictures of alligator stuff that we can do. And sometimes we can get little strokes, and the pictures look bad, but the patient's doing fine. And I always think to myself, we really don't use all our brain, do we? Because there's definitely a stroke right here, but the patient's doing fine. So this is what we don't want to have happen. Sometimes people are what we call locked in. There's an on and off switch in the back of your brain. It's in your brainstem. And that controls your heart rate, that controls your breathing, that controls every moving part in your body. And that's the place that turns off when you sleep. So your body goes to sleep. And if you have strokes in that area, you can become paralyzed, that you can't move your arms or legs, and you can only blink. And there's been people who have been what we call locked in. They're totally lucid, but the only moving part of their body is their eyelids. So so stroke is a devastating thing. This is a 38-year-old again, and that's what I'm talking about. There's a part in the back of your brain that is closed. Afterwards, we open it. So that can show it. Just to show you that this stuff we can do at a community level. This is our own data between 2005 and 2009. And 40% of our patients went home. 19% were partially dependent. 21% were dependent, 20% died. And it's a bad, you would think, well, these are terrible numbers. But when we compared ours to the national trials, and we've gone to most of these meetings, the national mortality is 34%. So this kind of technology can be done at a community level with excellent care. And these numbers are getting better. So make sure that if you go to your doctor and whoever you're seeing, if you think you're having a stroke, sometimes the patient knows best. You go to the emergency room. Sometimes we see a lot of patients, and you know your body better than anybody else. And if you think you're having a stroke, make sure you tell your doctor that that's what you think it is. And you can always go to the emergency room. And fast is the way to go. So that's it. I'll thank you for having me here.